Good evening. There are fears tonight that more health care services could be delisted.
The health minister has appointed a 16-member committee to look at ways to improve access for patients. Critics suggest it's just a way to slash the number of services being offered. Scott Roberts is covering this story. He joins us live from the News Centre with the details tonight. Scott?
Well, Carrie, there are two key areas this committee will look at. One is to recommend new legislation on health care delivery, and the second to potentially change the way publicly funded services are defined. And that has health care advocates very worried.
It seems like not a day goes by without healthcare being a lead story in the news.
And it is again today, the health minister making news this time, announcing yet another committee on health care reform, a year and a half after taking the portfolio and promising the opposite.
There'll be no more studies, no more commissions, no more roundtables. It's time for action.
But there will be more study, more roundtables. A 16-member committee now in place to look at some controversial topics, including potential changes to publicly funded services under the Canada Health Act and drafting new and updated legislation.
Legislation is only a tool that enables government to pursue specific policy outcomes.
Just what those policy outcomes are, the province won't define specifically, only saying they want to improve access for patients, but critics charge that deep cuts and delisting are the real goals.
I don't believe the minister. Of course this is about delisting. They want to restrict and limit the services that are available to Albertans.
The committee will make recommendations to the minister by mid-November, but there's no guarantee the public will see them all. A confidentiality clause hanging over committee members.
Obviously, we're paying for this minister, we're paying for this group, and you can't withhold that information from the Alberta public by using some legal trick.
And after years of study on healthcare reform, some are questioning the need for this committee altogether, fearing the findings could be a foregone conclusion.
If there was a real sincere intent to have health sector stakeholders and public consultation, this wouldn't be it.
This committee is made up mainly of academics, educators, and doctors. They will be paid for their time, likely per meeting, but Alberta Health could not tell us what that rate will be. Carrie?
So, Scott, did the health minister provide details on what legislation could be changed?
Well, he did mention two pieces of legislation. One is the Hospital Act. The health minister saying he believes more services can be delivered outside of traditional hospitals. He also thinks changes to the Nursing Homes Act could be in order.
Okay, thank you, Scott.
You're welcome.